Hello, I'm Dr. Michael Melkers. I'd like to invite you to a very unique event that's going to occur May 29th and 30th at Heathrow. Occlusion 2020, Seeing It Clearly. Now you got to ask yourself, why should I spend 2 days learning about occlusion? Honestly, you shouldn't. You wouldn't. There's no reason to learn about occlusion. What I'd like to share with you during these 2 days is what occlusion can provide for you as a tool to help you accomplish some goals. So if I think about what occlusion can do and what Occlusion 2020 is going to be all about, it's going to be about confidence and comfort for yourself and also for your patient. So what I'd like you to consider is, regardless of the procedure, how you approach a patient. And the patient can read your confidence. They can read your comfort as you recommend treatment. Those same patients can read your comfort and your confidence as you perform the procedure. So what I would like you to take away from Occlusion 2020 is I'd like you to be able to walk into that operatory, into your surgery, with confidence that what you're going to do is going to be at your very highest level. What I would like you to also be able to take away from Occlusion 2020 is I'd like you to be able to walk out of that operatory with confidence that you did your very best job, and your very best job is going to last as long as possible. Now, the third thing that you're going to take away from Occlusion 2020 is what you're going to be able to build. And I don't mean smiles and I don't mean teeth. I mean your reputation. Because the more confident you are and the more comfortable you are in not only recommending but performing these procedures are going to be perceived different by the patient, not just in the comfort and longevity, but what you've provided for them that feels good, looks good, and is going to last a long time. Because broken teeth can be very easy to fix. A broken reputation, once it's damaged, can be very difficult, if not impossible, for you to ever get there. So Occlusion 2020 is going to be a balance of communicating with our patients, treatment planning with our patients, and occlusion being the glue that pulls those two together to help you perform these procedures and make them last. We're going to go all the way from the basics of dots and lines on single teeth all the way up to full mouth rehabilitation and everything in between. We're going to talk about orthotics. We're going to talk about face bows. We're going to talk about articulators, but not in theory. We're going to talk about them in application. And I think one of the challenges that I've seen historically in occlusion programs is they show you the how, but they don't discuss the why. And I know I've been guilty of that. So what I've put together in my 25 years of clinical experience is bringing you the very best practices. Whether you're a one-tooth dentist and you want to become a two-tooth dentist or a quadrant dentist, whether you're a quadrant dentist and want to become an arch or a full mouth dentist, heck, whether you're even a full mouth dentist already, I hope and I know that there's going to be some great pearls for you if you can join us on May 29th and May 30th at Heathrow for Occlusion 2020. I hope to see you there, and I know if I do, you'll see it more clearly. We'll see you in May.